Dr. Gottlieb, are you confident that by boosting supply, that automatically means more shots in arms?
No, supply doesn't create demand and it doesn't create distribution, but the Biden administration is taking steps to try to expand the distribution. I think we're going to see steadily increasing supply of vaccine coming into the market and more sites where people can access it in a community setting. I think getting to a run rate of 1.5 to 1.6 million vaccinations a day is eminently achievable. And if you sort of stretch that out to the end of March, you can get to 75 or 80 million people who've been vaccinated, who've received at least one dose of the vaccine. Remember, about 40% of the vaccines that we're going to start delivering are going to be second doses. And so just because you have 120 or 180 million doses between now and the end of March doesn't mean you're going to vaccinate 120 or 180 unique people. A lot of those vaccinations increasingly are going to go to provide second doses to people who've already been vaccinated. But I think getting to 75 or 80 million people who've been vaccinated towards the end of March is achievable. It's a stretch goal, but I think that that's achievable. And once we get to that kind of a number, I think we're going to have enough vaccine surplus and enough coming into the market that by April, you'll see this made more generally available, even to healthy 40 or 50 or 30-year-olds. I think it's going to become more available sooner than we think.
Let's talk logistics. We've got the most extraordinary minds in science. That's how we got this vaccine so quickly. We also have the most brilliant minds in business and technology, yet we can't seem to sort out logistics. People can't get even basic appointments. Why did that happen, and how do we fix it?
Well, we didn't plan in advance for a system that would provide for community-based vaccination. Remember, the first thing we did was vaccinate healthcare providers and people in nursing homes. The nursing homes were relatively easy to reach. We did that through the big box pharmacies. Walgreens and CVS went into those locations. And to vaccinate the healthcare providers, we distributed through hospitals. But we didn't set up a distribution system nationally that would actually allow for community-based distribution. We left that up to the states. And so you have 50 different models. And quite frankly, the states were frozen for a period of time waiting for direction from the federal government. When I would talk to governors and ask them what their plan is, even on the eve of approval of these vaccines, they would say, we're waiting for the federal government to give us more direction. So I think the whole system was frozen in place. That's changing now. You're seeing states put in place scheduling systems. You're also seeing them start to distribute through the big box stores. I think we should be pushing more supply through Walmart, through Walgreens, through CVS, ShopRite, places like that that have scheduling systems, have vaccinators on site, know how to get a lot of people vaccinated over a short period of time because they do it every year for flu season. So they're starting to do that right now. Now, that doesn't completely solve your problem because those stores aren't in every community that you want to try to reach. So then you try to wrap around that. You take a sort of all the above approach. That seems to be what the administration is doing right now. When you look at their approach right now, it seems to be sort of an all of the above approach where they're trying to support different models across the entire country.
I know it's significantly smaller. It's much more like one of our states. But when you look at a country like Israel, that's pretty much been able to vaccinate almost their entire population, how did they do it, or what did they do right that we didn't?
Well, they put it through established distribution sites. So they used their military. They used they have a more consolidated healthcare system, 3 large payers in that country. So they were able to reach their population more easily. They also made sure they got supply early. So they bid higher than other countries and secured a supply of vaccine enough for a sizable portion of their population right up front. So they didn't have this situation where vaccine was becoming available on sort of a rolling basis. They got a bolus of vaccine right up front and were able to distribute it very quickly through these sort of consolidated distribution sites.
Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.